is the first time that the infrastructure of the information technology in healthcare supply chain of Thailand is studied. The first time we tried to apply the concept of logistics and supply chain into the hospital, we actually failed. The condition that we found out at the time is that the information technology or IT system of the hospital is not well integrated among one another. This integration of IT system causes inefficiency of medical products management in the hospitals. The disconnection of IT system that we talk about is the disconnection of the IT system that is used for patient care and also the IT system that is used for medical products management. When medical products are transferred from the system of medical product management into the patient care management, it kind of lost in the hospitals. So when the hospital are going to order the new medicines, the medical products, they don't actually know how many items of the medical products and medical supplies in the hospitals are. So they might order more than enough. This end up with overstocking or understocking of medicines and medical products in the hospital. We aim to solve the problem for the whole country, which is Thailand, to create the healthcare supply chain in Thailand to be more efficient. And also we aim to develop the big data platform for all of the parties, all of the organizations in the healthcare supply chain in Thailand. In order to get the big data for healthcare supply chain in Thailand, we plan to develop 5 projects. The first project that we do is for some hospitals. We create the Material Management Information System, or we call it MMIS, for all of those hospitals so that they can have the IT system to manage the stock of medical supplies, medical products, and of course, medicines as well. We want to connect all of the parties, all of the members in healthcare supply chain, right? So we create another project, Electronic Data Interchange, or EDI. This EDI system is the first thing or the first system that we try to connect the hospital with the medicine manufacturers or medicine distributors so that the orders of the medicine from the hospitals can be transferred to the distributors, to the manufacturers directly without hassle of all of those documentations. To make the EDI system work, we found out that these two parties have different identification of the medicines. So we create another project. We call it National Medicine Product Catalog Database, or NMPCD. This project is basically collect all of the medical codes or medicine codes into one database so that they can use the same codes that they actually use. They don't have to change the codes or anything, but they can communicate among each other. Another system that we create, we call it Track and Trace system. The track and trace system uses the data of the EDI system to display for the Ministry of Public Health where all of the medicines are in the country of Thailand. The next thing that we do is that the patient information leaflet management system is going to be included into NMPCD. So when the patient buy that particular medicine, they can know how they can use and what could be the side effect of this medicine by looking at that particular system. Another thing that we is currently doing is about the NMPCD as well. With the NMPCD, we basically have the codes that is used locally, but we found out that there is another code, IDMP. This is basically the standard that is used by some other countries as well. We basically mapped this IDMP code into the NMPCD with all of those local codes that used in Thailand. Another thing that we are currently doing is the business intelligence system. This system is basically collect all of the data from those systems and display to the executive of Ministry of Public Health so that they can use all of this data that we collect from this particular system for planning healthcare supply chain in Thailand. All of these systems that we created are being implemented. The impact after these systems are implemented is that, of course, we can track and trace all of the medicine. If they implement the MMAS, they can reduce some stock of the medicine products. The EDI system that is used for the hospitals, they can reduce the number of documentations. As I said that the hospital information system is separated into two particular systems. We plan to connect these two systems all together so that the whole supply chain, the whole healthcare supply chain can be integrated as one. The reason why we want to connect these two systems together is that currently we can track all of the medicine and medical products into the hospitals, right? But we don't yet know the location of the patients. When we connect these two systems together, we can track the medicine to the patients. If we have the problems of one product of the medicines, we can recall all of those medicine from the patients. We can create patient safety, which is a major goal for the healthcare supply chain as well.